Duchenne muscular dystrophy. What is Duchenne muscular dystrophy or DMD? DMD is an X-linked recessive disorder that affects the muscles because of the changes of the protein dystrophin. This protein helps muscles stay together, so someone with this disease will have typically muscle weakness that will progressively get worse over the years. Symptoms show up around the ages of 2 and 3. It mostly affects boys, and in very rare cases, girls can also become affected. This disease first affects the muscles around the core of the body, then affects the outer limb muscles. An inward curved spine can also be seen, along with heart and respiratory muscle problems. Like I mentioned before, DMD is an X-linked recessive disorder, which means that it's normally passed on by the mother, which are called carriers. Carriers typically do not show symptoms, but on some rare occasions they do. Skeletal muscle weakness to cardiac problems are some of the symptoms that can appear. For example, the Punnett square below shows a heterozygous female carrier and an unaffected male. This couple has a 50% chance of having a boy with Duchenne muscular dystrophy and a 50% chance of having a carrier daughter. This pedigree shows a male and a female in the first generation. The female, generation 1, number 1, is a carrier for DMD, which means she has the heterozygous genotype. They had 4 children, 2 males, one with DMD and the other without. They also had 2 females, both which are carriers. The 2 females carriers in the second generation, number 2 and 6, had children with unaffected males. Second generation, number 2 female, had a girl who became a carrier. Second generation, number 6 female, had 3 children, 1 female carrier, 1 affected male, and a female with no known carrier status. In the fourth generation, female generation 3, number 2, had a male with DMD and a female with no known carrier status. Generation 3, number 4 female had 2 females, one with an unknown carrier status and another female with a known carrier status. Generation 3, number 6 female had a daughter with no known carrier status. Lastly, Generation 4, number 4 female had 2 males, one with DMD and the other without. Most of the women in the pedigree had the heterozygous genotype, meaning one of their X chromosomes carries the allele. The females, generation 3, number 6, had a girl, so she will not know if she carries the mutation. Same thing for generation 4, number 2, 3, and 6 females. They will not know if they are carriers until they either get tested or eventually have a boy with DMD. What can be done? The life expectancy of a male with Duchenne's muscular dystrophy is about 25 years old. Like the picture below shows, around the age of 2 to 3 a child is diagnosed. Creatine kinase blood test, genetic blood test, a muscle biopsy, or an electrocardiogram, also known as EKG are tests typically used to diagnose DMD. Around the age of 8, muscle weakness becomes more apparent, but by the time they reach about 15 years old, they're wheelchair bound. Now, there may not be a cure for this disease, but thanks to advancements in cardiac and respiratory care, life expectancy is increasing to the early 30s. There are ways to manage this disease. Some examples include corticosteroids to help delay the loss of muscle strength. Medication is normally used to treat cardiomyopathy. Physical therapy is used so that the muscles do not tighten from non-use. Surgery to treat scoliosis, and lastly, and most importantly, exercise so that the patient can avoid muscle atrophy. There are several future research studies for curing DMD, like gene therapy, exon skipping, stop codon read-through, and gene repair. Hopefully, one day we will be able to stop this mutation from affecting so many individuals.